some people can have intercourse with someone with HPV and not even get it, right? And some people, you get it and maybe in 6 months it's gone. But we like to say 2 to 3 years, so that we're not putting pressure on people to feel like if you keep getting tested and it's always positive, that there's something wrong with you. And you know, even if you're completely healthy and doing all the right things, it can still continue to persist even past 3-5 years. It doesn't mean there's something wrong with you. It's just the nature of the virus. It's quite stubborn. So the most important thing to know is that if you know you have HPV, especially if it's a high risk type, that you keep getting the cells of your cervix checked to make sure that this virus is not transforming your cells into something possibly cancerous.
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA, SHIF, UHC change that, or is there more? Or perhaps, what's the difference between a pharmacy with a Blue Cross and a Green Cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more? Women's health, men's health, your children's health, the economy, this and more awaits you on season 2 of Kenya's favorite health podcast. My name is Dr. Diana Wangari-Gitau, and welcome to season 2 of the One Health Lens podcast.
Hello everyone, welcome back to the One Health Lens Explained podcast. I am your host Cheryl Blessing, and I am joined live on set by the amazing Dr. Kenya. Welcome back. How are you?
Thank you. Thanks for having me back.
Yeah.
I'm good.
It's so lovely to have you once again, because we were just talking about some other STI, and today I want us to get into a different one. We are talking about HPV today. HPV is something that I'm sure all of us have come across, but we're not entirely sure what HPV is or even how extreme it can get.
Yeah.
So let's break it down. Dr. Kenya, what is HPV?
What is HPV?
Yeah.
Great place to start. So first of all, HPV stands for human papilloma virus. Okay, last time we talked about herpes simplex virus. Today it's human papilloma virus. And guess what? There are over 200 types that can infect you.
Hold up, because I think based on our last conversation, we got to the point where we realized that you can't cure viruses. You can only manage and treat viruses.
Yeah.
But now there are 200 viruses of HPV.
That over 200.
OMG. Okay,
right?
Please explain that.
First of all, HPV is sexually transmitted, right? Which means you have intercourse, someone can infect you, you might have symptoms, you might not have symptoms, right? But the good thing, at least, about HPV is that once you're infected, most of the time, that's like 80% of the time, you're able to fight off this virus on your own within 2 to 3 years. So you can test positive for HPV type something today, and then after 2 to 3 years, it's gone completely. So HPV, then there are over 200, and they are named according to the numbers. So HPV 1, 2, HPV 3, HPV 4. So there are a few which are called high-risk types. There are like 12, which we usually look out for when we're testing people. And then the rest are low-risk types. So the high-risk types can put you at risk of different kinds of cancers. So the most common is cervical cancer. I'm sure you've heard of cancer of the cervix.
Yeah.
It can also cause cancer of the vulva, the vagina, the anus. It can also cause cancer of the mouth and the throat and the head and the neck, because it can also infect you, just like herpes, either orally or it can infect you genitally, depending on how you contracted it. So it can be tested. Do you know if you have any of the HPV types?
I don't even know. And first of all, how can you even tell? Are there symptoms that manifest physically? Because we talked about herpes, and it's kind of, there's a period where it's active and then it's inactive. You get sores, you can visibly see ulcers and things of the sort. Is it the same with the HPV? Can you physically see some symptoms?
It's kind of the same, but not really, because for HPV, there are some types which can cause genital warts. Have you ever heard of genital warts? So you can get warts on the skin of your arms, your legs, your feet. You can also get warts in your vulva and vagina, in your genital area. So you can have warts, and that can tell you that you have a certain type of HPV. But there's so many other types of HPV, like the ones which cause cancer, that don't really cause any other symptoms. So they're just living there in the cells of your cervix or your vulva, vagina, anus. And slowly, if your body is not able to fight off this HPV infection, then the infection starts causing the cells of your cervix and your vagina and your vulva to transform and become abnormal. And if left without treatment, can actually turn into cancer. But imagine, from the time you're actually infected with a high-risk HPV to the time it becomes cancer is like 10 or 15 years.
OMG.
So you can imagine someone who has cervical cancer has had this HPV for so many years, decades, sometimes even 3 decades. And if only they had HPV tests or pap smears at least done a couple of times within that period, we would have caught it early and treated it so easily and affordably. And that's why I'm here today, to really advocate for you knowing your status, so that we can prevent something that is so avoidable in the future.
So how do we get tested? How can you know if you have any kind, because if it's like 200 plus, you know,
you can imagine, like, how do you even start?
Where do you start?
It's actually so simple. All you need to do is go to a hospital and ask for a HPV test. Okay, it's done the same way a pap smear is done. So you're made to lie down. We put something in your vagina that opens it up so that we can see your cervix, and we just take a little brush and brush your cervix. So when we do that, we can do a pap smear at the same time as a HPV test. A pap smear is just looking at the cells that we have brushed from your cervix to see, are these cells normal, or do they look like they are going to turn into cancer in the future? And then a HPV test is actually testing for the virus DNA in the
that
sample.
might be in the
so
cervix.
we can kill 2 birds with 1 stone. And you know what? If you're someone who doesn't like going to a gynae, I've just described the procedure and it sounds scary to
People
you.
look like, oh my, after the COVID tests especially.
Right.
Do you remember they used
and now
to put
you can
something
imagine
up your...
it's down there. So you're probably thinking, oh no. Guess what? We have self-testing kits, which you can actually buy from a pharmacy or from a laboratory, and do it yourself at home, and then drop the sample at the lab, and they'll contact you with the results. And if you want your results to be explained to you, then you can go see a gynae with it. But it's so important to know your status.
And what about for the men? Because now this is women we're talking about. What about the guys? Are they affected by HPV, or is it just for women? How does that work?
So men are definitely infected and affected, and that's how women get it as well. So the unfortunate thing is that there is no valid test for men. Okay, because women, we have a vagina where you can put in a swab and collect the cells from the cervix. For men, we don't really have any reliable test that has been made for them. So that's why we're focusing on testing women. And by extension, their men will be protected. And so when do you actually start testing someone for HPV? We usually start about 3 years after you've started having intercourse. So, we can't put a specific age on it, because people are really starting to have intercourse at a young age, different ages. So we want to start as early as possible after starting to have intercourse. But the great thing about it as well is, there's a vaccine for HPV.
There is, which is so cool. Could you tell us about that? Perhaps can you get it even at a very, very early age when you're a teen or something?
Yes, because remember, this is a sexually transmitted infection. So if there's a vaccine, we want to vaccinate you before you even start having intercourse, so you can have the most protection. Otherwise, we might be vaccinating someone who already has an infection, which doesn't make sense. So guess what? From the ages of 9 to 14, we can start vaccinating our girls and our boys. And that's what we're really, really trying to push and advocate for. There's been a lot of talk about, what are they putting in those vaccines?
Yeah.
Are they trying to sterilize our children? If you vaccinate children against STIs, then that's going to encourage them to start having sex early. That's not true, and studies have shown that that's not what's taking place. But what is happening is we're protecting our young girls and boys from getting cancer that is caused by different types of HPV in the future.
Yeah.
So let's try and vaccinate our girls and boys from the age of 9 to 14. And if you happen to be older than that, like right now you're listening, maybe you're 32 years old and you're thinking, I wish I could have that vaccine. Will it be helpful for me? It can. What you need to do is be tested for HPV and get a pap smear. If they're both normal and negative, then you can also be vaccinated. Up to the age of 45, you can be vaccinated. That's for women.
And when you're talking about the vaccine, so many of us are aware that it's usually the virus that's they rework it somehow and they introduce it to your body so that the antibodies can fight against it.
Yeah.
Is that what goes into the vaccines, the HPV vaccines? Because that can be a worry, that can be a concern. Because if you're introducing a virus into a young a teen's body or something, will it affect them?
That's a good question. So there are different ways of making a vaccine. Some use the virus, which is weakened. Some vaccines use a piece of the virus. Some is an inactive virus. Some is just an antibody, right? So for the HPV one, it's just a piece of the virus. So there's no way that being vaccinated with from HPV is going to give you the infection. So it's not possible, and it's not going to be harmful. Obviously, there are side effects like there are with any other vaccine. Once you get vaccinated, there might be pain and a bit of swelling at the site. You might get a bit of a fever, some flu symptoms, but after that, all is well.
And now getting into the types that cause cancer, because now let's put those on the side. These other types, they do not pose a risk of something more. Do they pose a risk of you getting another disease or another virus? Does it expose you to all these other infections once you have it in your system?
So like you said, they're the ones which cause cancer, and then they're the ones which don't cause cancer, right? So these ones include the ones which cause the genital warts or the warts on the hands and the feet. And then there's so many others which literally just don't do anything. They're just there. They're not harmful. They're not putting you at risk of anything. But generally speaking, having HPV is going to put you at risk of having other STIs. I like to say STIs are very social. They like hanging out together. So even having any other STI is going to increase your risk of having HPV, HIV and all that. And the things that can increase your risk of having HPV are starting to have sex very early, which is why we really need to be talking to our girls and boys and educating them on safe sexual practices. Having multiple sexual partners, having a partner who has multiple sexual partners, because some people are in relationships.
Niko na wewe but tuko na others.
Per person sharing kind of relationships. So it's important to also know your status of other infections, because then you're at increased risk. If you're smoking, you're at an increased risk of having HPV.
So it also trickles down to the lifestyle again.
Once again. And that's another thing. Once you have HPV, say for example, if you go and be tested today and you're told you have HPV type 58, which is a high risk type, it doesn't mean I'm going to be taking you for surgery and removing your whole cervix. It just means I'm going to be monitoring your pap smears closely to make sure that if there's a change in the pap smear, that means there's a change in your cells of your cervix, we're aware early, and we're more likely to do something about it if it gets to a point where we're not happy. So just to make us more aware, and you can come, I test you today, we find you have HPV type 58, and then maybe you come after a year and it's still there, but your pap smear is normal, your cervix is normal. Then you come back even after one more year and it's still there. Then you're like, Dr. Kenya, why isn't my body fighting off this infection? What can I do about it? There are not very strong studies about things you can do to clear this infection. Your body generally does it on its own, but there are some studies with some mushroom supplements and zinc and folic acid, just supplementing, making sure that your immune system is strong by eating healthy, like we talked about with herpes, by having some physical activity, managing your stress, just the same, but giving your body time to fight off the infection while monitoring your cells of your cervix to make sure that nothing cancerous is happening. And once we catch something cancerous, we treat it early to make sure that it doesn't become something big.
Yeah. And why do these specific types that you're talking about, why do they lead to cancer? Is it, you've talked about it reacts with your cells to modify it, and that's what we know basically cancer does. It's just your cells modifying and just, reworking. Why does it cause your cells to do that?
You mean why do some specific types do that while others don't?
They
have certain proteins in them that can do that, basically. It's just their nature.
Okay, so when you catch it early, then you can, and you don't even treat it. There's no medication, there's nothing that you can administer to,
Once you start seeing changes in the cells, there are some medications your doctor can give you to insert vaginally for a few months to see if these changes can reverse on their own. Because imagine we've said HPV, once you get it, your body can fight it off on its own. If not, then they're going to start causing abnormalities in your cells. But even at that point, your body can reverse those abnormalities. But we're still continuing to monitor. So if your body doesn't reverse those abnormalities on its own, with its own immune system, we can give you some medications to help, which can help. If they don't help, then we might have to do certain procedures where we're actually cutting out the abnormal parts of your cervix to make sure that we're leaving a healthy cervix and a healthy uterus. Obviously, if we catch it at a point where it's already cancer, where it has already affected a majority of the cervix or the uterus, then it can reach a point where we have to remove the entire uterus.
And I think that's an extreme to get to, which I hope most people don't get to.
Unfortunately, we are getting there a lot because of lack of awareness of how cancer of the cervix is caused, lack of awareness that you can test for HPV, which causes cancer. You can vaccinate against it. So imagine if you have this information now, you talk to your loved ones, talk to the people in your circle. If you have a chama, please tell them you can get tested for HPV so that you can prevent cervical cancer in the future, and you can protect your partner from getting cancer of the penis and of the mouth and the head and neck.
I really love that, because these are conversations that we tend to steer away from, because they're difficult, they're very sensitive, and people don't like talking about them. But the more aware we are, the more prepared we are for the future. And you mentioned doing tests to get like a screening, because the guys can't, it's harder for them to be tested. So once perhaps I've found out that I have HPV, does that automatically mean that my partner also has it?
Not necessarily, because if you are tested today and you're found to have HPV, you can't tell where you got it from unless that is your first and only sexual partner. You could have gotten it from a partner years ago and you still have the infection. You can't tell the timing of when you are infected. You see what I mean? So unless that is your first and only partner, you can't say I got it from this individual. You could have gotten it before, at some other time, and your partner also can't tell who they got it from. So
how is it transmitted then? Do I have to have active wounds and warts and all that for it to be transmitted from one person to another?
No, for it to be transmitted, you just have to have intercourse.
So unprotected intercourse.
But just like herpes, even using protection is not completely protective. It's not 100%, because again, it's on the skin, apart from just being in the secretions of the mouth and the genitalia. So you can still get it from close skin-to-skin contact during sexual activity, but obviously using condoms add protection, and if you use it correctly, it's even better.
And I think that's very fascinating, because most people will assume once I have a condom, then we're protected from all these other things.
Not necessarily.
But you have to go above and beyond. You have to know your status. You have to be healthy. And I love that we're insisting on health.
On this health,
Yeah. General health,
Yeah.
not just your reproductive health or something.
Exactly.
You have to have a very healthy body so that your immune system is working well to
Able
fight
to
off the
fight it
viruses and all that.
Yeah.
Now, I'm wondering, you've mentioned it takes about 2 to 3 years for your body to completely fight it off.
Yeah.
Why does it take that long? Why isn't it like in a few months I'm good? Especially if I'm maintaining a very healthy lifestyle. I eat healthy, I work out, my stress levels are good, my mental
Yeah.
health is in check. Why does it take that long to just fight off the virus?
It's just the nature of the virus. In some people, they can fight it off. Some people can have intercourse with someone with HPV and not even get it, right? And some people, you get it and maybe in 6 months it's gone. But we like to say 2 to 3 years so that we're not putting pressure on people to feel like if you keep getting tested and it's always positive that there's something wrong with you. And you know, even if you're completely healthy and doing all the right things, it can still continue to persist even past 3-5 years. It doesn't mean there's something wrong with you. It's just the nature of the virus. It's quite stubborn. So the most important thing to know is that if you know you have HPV, especially if it's a high risk type, that you keep getting the cells of your cervix checked to make sure that this virus is not transforming your cells into something possibly cancerous. Yeah.
And you mentioned type 48 being one of the 58 is one of the high risks. What other types should you look out for?
So there are 12 of them. There's 16, 18, 31, 33, 52, 58, a couple others. I don't know them offhand, but if you just Google HPV high risk types, you'll get a list. And also when you get tested on the report, it's going to tell you which HPV type you have. By the way, you can have more than one. You can have 5 different HPV types at the same time, and it'll tell you which ones you have that are low risk, which ones are high risk, and your doctor will also explain to you in detail about your specific situation. Because remember, if you have other things going on, maybe your immunity is low, you have HIV, you might want to be tested a bit more often, you might want to be monitored a bit more often. So it depends on you.
And that means then you can have multiple types, and as long as other STIs are also in place, it makes it more dangerous once you have multiple. Let's say you have 5 different types of HPVs, and if you have other STIs as well as that, it makes it more dangerous, or does it not affect it?
I wouldn't say that having many types is more dangerous, because maybe none of them are even high risk types, right? You can have like 6 types and none of them are the high risk types, which is good. But what we just know is even if you have even one high risk type, we are monitoring you closely, but not necessarily that if you have more that you're at a higher risk.
So it's just the types you have to be aware of, the high risk types.
And definitely on top of that, if you have other sexually transmitted infections on top of that in the mix, then that means your immunity is low, and it can cause the virus to progress faster and make things worse in terms of going towards cancer.
Okay. So those are things that we should be aware of, because they lead to multiple types of cancers. And it's so fascinating, because you were talking about even cancer of the mouth, cancer of the throat, anus, penis, and I don't think people would think that can happen. It can happen,
and it does happen out here. It's just that people are not really talking about it so much. I think we are always also focusing on cancer of the cervix, because it's the second most common cancer for women in Kenya after breast cancer, and it's the most common cancer in East Africa in women. So definitely more awareness is needed, but we also need to let people know that it also causes other cancers. And so let's be aware.
And would you recommend doing tests every year? Would you recommend annual tests just to make sure that your body's in check, you don't have any of these viruses, or if you do, you're aware of how to manage them?
So for the HPV test specifically, every 3 to 5 years is okay. For pap smear, every 3 years is good. But if it also depends on your specific situation, which is why I would love for you to have a conversation with your gynae after your own test is done. Because like we said, if you have HIV, you might want to test more often, because you know that this infection in you might progress faster because your immunity is low.
Yeah,
if you are someone who has multiple sexual partners, you might want to test more often. So depending on different things, also depending on how your previous test was, you might want to test more often or not. So it really depends. But for the general population, I would say every 3 to 5 years for both a pap smear and a HPV test, just to keep knowing your status.
And I think that's a wonderful note to end on. Just get tested frequently. And I think we need to advocate for health, like overall health, because that's the one thing that I've picked from all our conversations. Having your immunity at like a very optimum state is what prevents most of these things. So guys, get tested, be aware of your status, your full spectrum status, and be healthy. Ensure you try and live a very healthy lifestyle. Keep your mental health in check, your emotional health in check, and just be aware. Talk about these conversations with your groups, because you know, information is power, knowledge is power.
Exactly. And I'll have to add, vaccine. It's one of the only vaccines we have against a virus that can cause cancer. So it's such a huge leap in science that we've made, and we need to take advantage of it, not just for our kids, but also for ourselves. So look into it.
Thank you. I love that. So I hope someone has taken something away from this. Hopefully you've taken every good information from it. And that's it from us for today. I've been here with Dr. Kenya. My name is Cheryl Blessing, and you have been listening to the One Health Lens Explained podcast.